Hello and welcome to another Dolphin Financial Radio Show with me, Dan Wendell, owner of the Dolphin Financial Group. Today, we're going to be talking about the American Rescue Plan. This was the most recent stimulus package passed by the Biden administration in March of 2021. In particular, we're going to be talking about how it changed drastically health insurance in our country. So if you are on the fence about getting a premium subsidy or a cost reduction for getting health insurance, you don't get health insurance through your company or your employer, you're going to want to listen in because you may have gotten pretty far along in the process in the past and said, this is too expensive for me, or you may already be on the federal marketplace or your state marketplace and are saying it's still too expensive. Well, things have changed. And we're going to talk about them in today's show, so stay tuned. Tony, let me tell you something. We're doing a podcast today, but we're also on video.
You are about to listen to an episode of Dolphin Financial Radio. Each week, host Dan Wendell, a certified financial planner, is joined by his sidekick, Tony, to discuss financial issues, news, and tips. Dan keeps the focus on retirement planning, and Tony keeps the show fun and down to earth. Now, let's have some fun planning your retirement and begin the show.
There we have it. Welcome, Tony. Good to see you. We're going to be talking about healthcare, and I promise I'm not going to rant about it
Sure.
as I've wanted to do in the past. But you thought, well, why are we talking about healthcare? It's not open enrollment. I want to explain the new rules in the stimulus package that just passed.
Uh-oh.
Major changes, Tony. Major.
Communism, taxes, healthcare.
So which one do you want to talk about? Pick one of those.
What's the stimulus plan going to do for us?
Communism, taxes, healthcare.
We're going to talk about all three of those today, actually. Now that I think about it.
All right. Well, maybe not the first one. Maybe we should avoid the politics, but it's kind of hard when you're talking about a $1.9 trillion bill.
I'm not going to get into that, but I will say it's called American Rescue Plan, which is, I didn't know we needed to be rescued, but hey, why not? We got to keep the lifeguards afloat. So keep them fat and paid. So we're being rescued. But what has happened as part of this plan? Last week, we talked about how to reduce your AGI retroactively, adjusted gross income. So it was a tax discussion. And this time around, we're going to be discussing it even more because a lot of the stuff that's happened in the American Rescue Plan has to deal with taxes, but I want to specifically focus on healthcare. And in particular, I want to talk about healthcare subsidies because that certainly was the big change that I noticed. And nothing's changed about health insurance. It's still expensive, right?
Healthcare. We've had shows on that before. I'll tell you that.
Yeah,
it's outrageous.
Nasty. It's nasty. But what has happened is health insurance hasn't changed in cost, but the amount of subsidy that the government will give to people and who they'll give it to has changed dramatically. So we're talking about the American Rescue Plan. Did you know that that's what it was called? I don't even know what round of stimulus we're on. Is this like 3 or 4?
When I read it the other day, and before that, I heard about the stimulus package, and then once it went through, I read somewhere it was called the American Rescue Plan. And you said, you don't even know if we needed to be rescued. But I speak for yourself, Dan, because we all have different problems.
And also I have bad posture and severe financial problems.
Right? I mean, there's different problems for different people out there that do need help. But yes, that is an interesting title to this bill.
Yes. So I'm not going to debate it because I've gone in the past shows. I've said that stimulus checks shouldn't be given to retirees. That I've said some controversial things, but
controversial.
I think what I want to say in this one is it really addresses healthcare in several major ways, and it's a good thing. So let's talk about, so people that have health insurance through their employer don't really pay attention to this. And that's one of the major problems is people don't realize how expensive it truly is because their government is paying, their employer is paying for it.
Yeah.
So the people that don't get an employer coverage or isn't heavily subsidized by their employer have to go on their own and get it. And
or
so,
the self-employed or people
Right.
who own their own businesses.
Or for companies or for people that work for an employer that just doesn't offer it.
That's true.
Or doesn't subsidize it. So what they have to do is they have to go to the marketplace, and each state has their own marketplace. And if the state doesn't have a marketplace, like in Florida, you use the federal marketplace. And so there was, I mean, we're on, I think, 10 years of this now. I think it's been people call
Since
it Obamacare.
Obamacare, the
Right,
Affordable
but
Care Act.
Affordable Care Act is a technical term. Obamacare is what everyone called it. And then there was a good 5 or 6 year period where people just refused to acknowledge that it's just a insurance that's subsidized by the government. It's not government created insurance. It's still created by insurance companies.
Sure.
So insurance companies are still the enemy, right? We'll just say that. But okay, so the government's going to come in and help and give a subsidy to certain people. And the way it's always been has been you need to have 400% of the federal poverty level or less. If you have 400% of the poverty level, you'll get some sort of subsidy. If you have 300, you'll get a more subsidy. If you have 250% of the poverty level, even more subsidy. All the way down to 100% of the poverty level, you're getting basically free health insurance. It's not free. The government's paying for it.
Yeah.
So that has changed. And we talked about in the past how if you were at a level where you don't get a subsidy because you make too much money, if you make $1 over the limit, you get no subsidy. If you make the limit, you get a subsidy. And there was that hard cliff, as I called it. It was a cutoff, right? That
to the dollar.
That has changed. So what they do now, instead of saying you have to make 400% of poverty, they still have the poverty levels. So the less money you make, the more of a subsidy you get. But if you're over the 400% of the poverty level, you still can get a subsidy. What they've done is they've changed it to 8.5% of your modified adjusted gross income.
Oh, that's what you put Magi on the screen. And I thought we're talking about the Magi. It's not even Christmas. I thought maybe you misspelled MAGA. But
either way, you're off the mark there.
Okay.
But a lot of people might be saying, I'd rather talk about that. But no, I'm talking about modified adjusted gross income.
Okay.
So I'll give you a hard example with real numbers so that you can give an idea. And I've used this example before. Retired couple in their early 60s. So let's call them 62, husband and wife. They're both 62 for easy math. Okay. The subsidy level is, or the income level, the modified adjusted gross income level. And we talked about it in the last show. If you're above that level, we want to get it lower. You can still lower it for 2020. So if you're above the level, you normally wouldn't get any subsidy. You get zero, even by $1. And that level is $69,680 for a married couple. So if a retired couple, they don't work anymore, so they don't have employer coverage. They're not old enough for Medicare. So they're in that window of really expensive health insurance with no one helping them buy it.
Yeah.
They make $69,681. They don't get any subsidy. If they make $69,680, they get a subsidy, probably close to $1,000 a month. It's that big. So the cliff is eliminated for 2021 and 2022 as part of the American Rescue Plan. And what do I mean by that? The new rule is that the cap on the subsidy, or the cap that they can pay, that they'll have to pay, is 8.5% of their modified adjusted gross income. So let's imagine the couple had $75,000 of modified adjusted gross income. Normally, they'd get zero subsidy. They'd pay full price. But now they're going to pay 8.5% of their income toward that. So what does that look like for a married couple? It's based on your zip code. So I'm going to look at Pinellas County in Florida, in Clearwater, we'll call it. They look at, it's funny, Tony, the way they make these rules. Second cheapest silver plan, SLCSP, second cheapest silver plan, silver level. So remember the healthcare plans are bronze, silver, gold, platinum.
Yep.
I think, right? So they look at the second cheapest silver level plan in your zip code that's available to you, and that's the number they use. And they take 8.5% of your income and compare it to that. So I want to talk about this. So the new rules,
because I don't understand. I don't
70
understand.
All right, so 75% of $75,000. Okay, 8.5% of that is 6,375. So what the government is now saying is that they only have to pay 6,375. That couple does. That sounds like a lot of money, but when you look at the silver plan in their count in that's available to a couple, 62-year-old couple in Florida, in Clearwater, it's $2,039 a month.
Month.
That's the second cheapest silver plan.
A month.
Yes. So what is that? That is $24,000 a year.
Well, that's nobody can afford that.
Right. So
that's more than your mortgage. Well, not yours, maybe in the castle thing you live in, but for the most of us, Dan.
When you add the moat in, yes. Once we throw the moat in, and
Dan!
then I no longer chlorinate the moat so that my son doesn't have to swim around the house. We bring him to the YMCA pool. So 24,000, but now they're limited. The new rules state that they only have to pay 8.5% of their income. So their income is 75,000, so they have to pay 6,375. So you subtract that, they are now going to get a subsidy, theoretically, if they get that plan, of $18,000.
Wow. See, that is huge. That does make a difference. Now I get it.
So instead of getting zero because they made too much, they were over the 69,000 limit, they're getting 18,000. 18,000. Huge difference. So a couple sitting there making 80,000 in retirement, they're not on Medicare yet. They've never qualified for subsidy because they make too much. They now can get over 10,000, 18,000 in a subsidy.
Wow.
If they get that silver plan. But let's say the plan was only, instead of only 2,000, let's say it was only 1,000 a month. They'd still have to pay 12,000 normally. Now they only have to pay 6. This is huge. This is huge because it doesn't matter how much you have in assets. You can have $50 million sitting in your checking account, like you, but it matters about income, modified adjusted gross income. So in this case, it's totally changed the game. Changed the game.
That is a game changer. I mean, I'm sitting here on all this radio co-host money.
Right. And so, but you've been hoarding it. You've been hoarding that money and they don't care about it. So they only
all that money, Dan.
They only care about your salary. But you never had to worry about it because you were well below 100% of the poverty level. Yeah.
Well, and you've helped us with learning what helps in this is learning how to modify that adjusted gross income in your favor. So you get more of these benefits that this 1.9 trillion surplus stimulus package, not surplus, but stimulus package is offering, right?
That's right. That's right. And there's another benefit, Tony, which is getting a subsidy is one thing, but there's also these cost share reductions. And cost share reductions start at, I believe, 100 or 250% of poverty level. So we talked about how you can make more than 400 now and get a subsidy. But if you're at 250% of poverty level or less, you get even reduced. Not only do you get the premium, you get the reduced cost, but your deductible goes down. And if you're at 100% of poverty, you get zero deductible. So you theoretically have basically almost free health insurance. The government's covering you at that poverty level. The reason why I bring this up, that hasn't changed. But what has changed is how you determine if you're at poverty level. Normally, it's based on your income. But what the rule says, which is crazy, is if you have 1 week of unemployment, if you got 1 week of unemployment, you are automatically deemed to be at 133% of poverty level.
Wow.
So
I thought you went by what job you had. Like if you're, say, in the food service industry or radio co-host, that determined that you were in fact at poverty level.
Well, that's understood. That's understood. You're at that poverty level. But let's take you, for example, because you have the side gig, which you sell LPs on the side. So
Sure.
you're making well over 7 figures with that. So let's say now, you've never gotten a subsidy before. And now let's say you get 1 week of unemployment. You are deemed to be at 133% poverty level. So what does that mean? Not only do you get a huge subsidy, meaning your premiums are going to be drastically reduced.
Yeah.
You also going to get the cost share reduction. So your out of pocket maximum, your deductibles and copays go down.
Wow.
Just
and that's
you
part of the
1 week.
And that's part of the stimulus package. That's in
part
there.
of the American Rescue Plan.
There's
March 2021.
There's so much in there. I mean, there's additions to the child tax credit. I mean, we could talk about all the other things, but I didn't realize there was this much, Dan, just about healthcare in there that affected healthcare benefits.
That's why we're talking about it, because we could talk of all the major things that are in there, and lest we forget it's about COVID. So that apparently there's some COVID prevention stuff. Who knows?
They threw that in there for good measure.
Right, to give it the name, but American Rescue Plan. So like I said, 1 week of unemployment check, you're deemed at 133% poverty level, regardless of your assets and income.
That's
mind-blowing, right? So
that is crazy.
Great. I wish they would have told me this when open enrollment. Well, they opened up open enrollment.
That's true. Now, I heard that. I did hear that.
You're watching this now. Let's say it's March, or let's say it's April of 2021. You're like, great. I had an unemployment check, but I was paying for my own health insurance, and I make a lot of money, or I'm on that threshold where I make just enough where we don't get it. Now you qualify, and now you can enroll for coverage effective May or June. Of 2021. So this is really timely. This is crazy. There's a lot of money on the table here. People that didn't get a subsidy before might get tens of thousands of dollars in subsidy. People that were had a $6,000 or $8,000 deductible might now have a $0 deductible or a $500 deductible. It's crazy, Tony. When I was reading this and learning about, I couldn't believe it. And wait, there's more. There's more, Tony.
But wait, there's more.
Yes. All right. So there's new
not tables. Available in stores.
There's new tables of how much you have to pay based on poverty level. And like I said, 400 was a limit. Now you can make more than that and you still get a subsidy. But let's take the 150% poverty level. Last year, if you were at 150% poverty level, you were expected to pay 4% of your income toward health insurance. They've lowered that to 0. So a lot of people are at that 150% of poverty level. And they were paying, and oh my God, I'm still paying 4% of my income. That's $400 every 10,000 I make. If someone's making $40,000, they're paying $1,600 a year for health insurance, and that's a lot for them. But now that's gone to 0. So they changed everything. So people that are on subsidies now need to review and say, can I lower my subsidy? Will it go lower? And do I now qualify for an even better plan? They need to they need to look and say, I want to re-enroll. I want to go back and change my plan.
Yeah, and how are they letting people? How are people finding out about this to reevaluate where they're at and what they qualify for?
I don't know. Well, the insurance companies, I mean, who's going to promote this? The insurance companies might, because they might get some new people on.
Sure,
but it's going to be the government outreach. And shows like this that hopefully people watching will be like, wow, I want to know, do I qualify for a tax credit now?
Sure.
You better look. You better look, because everyone does now. There's no income limits. It's all a percentage of your income. So here's another one, Tony. I want to this is big. This is before I want to end on this one, because okay, let's imagine in 2020 you said I was going to make, and this is one of the big problems people have when they go for insurance. How much money are you going to make this year? I don't know. I'm in radio. I could make $1 million, or I could make $3 million, I'm in radio. I can't even say it with a straight face.
Oh, Dan! Dan!
they say, I don't know. I don't have a job, or my job, I'm self-employed. I don't know. I might make 50,000 this year. I might make 35,000. How do I know? You have to guess, right? So you've always had to guess. And what happens is you guess what your income is going to be, and then you reconcile at the end of the year when you do your taxes. And the government sends you the healthcare.gov sends you the form and says your 1095A and says, here's what you said you were going to make. Here's what you made. Here's how much credit do you owe? Do you get extra? They've eliminated that. So if you, and this is crazy, Tony, if you've underestimated your income and said, I was only going to make 40,000, but instead you made 60,000. And instead of getting a $1,200 a month subsidy, you were supposed to only get a $500 a month subsidy. You got $700 a month too much. Government's not going to come after you. No clawback.
What?
They're not going to.
How is that even possible?
Maths.
They're just printing money at this point, I guess, to make up for all this. I don't understand. That's amazing.
Your unborn grandchildren will be paying for it, Tony.
We're kicking that can. We're kicking that can. But I think people do need some help. And so these, this is going to benefit a lot of folks out there. But obviously they need a financial, Dan, what I'm hearing here is you have to have somebody who's read through this and at least has some knowledge of it to help you look at your situation and say, hey, you're in a position where you should, don't overestimate, because you could be in this situation where it's going to benefit you. And so that is really interesting. And it's great that there's no clawbacks for those people. I mean, it's really going to help those people. Now, all these things you've been talking about, though, Dan, I have to ask, and maybe you were getting to this, but I heard you mention it briefly with one of the first points you made, but you said for the next 2 years or something. Is there time limits on all these added benefits and perks and rules that are going to benefit people financially regarding healthcare?
Technically, yes. 2021 and 2022. And then after that, we don't know. So it only goes out for this year and next.
Sure.
But odds are, once they give that benefit away, they're not going to take it back. You never know.
It'll be harder, but you never know, though. Yeah.
But I'm going to say this: the gravy train is rolling by. You got to get on. You got to get on. I mean, really,
you have to take advantage of things while they're available to you. I think that's got to be the lesson here, isn't it? Especially regarding healthcare costs, because they're stupid expensive.
They are, right? So, and this is the government's way of kind of sweeping it under the rug instead of fixing the big problem, which is why the expense is outrageous. But I don't like it, but I'm going to help people get it. I don't like the fact that, I underestimated my income and I got too much subsidy. Oh, you're not going to take it back?
Yeah.
The government's going to say, well, you can give it back if you want. It's like the people that say, I hate, higher taxes, and or I like to pay my, you could always pay more in taxes if you want. If you like taxes that much, why an extra check? No, I'm going to take advantage of the tax laws. So these are crazy. There's going to be unintended consequences here. The health insurance subsidies are out of control. I think a lot of people are going to qualify that never did. We're talking thousands of dollars. It's going to make the $1,400 stimulus check look like a drop in a bucket when you think about it. Not clawing back. I mean, this is crazy. And I think the important part is, Tony, a lot of financial advisors, to a fault, shun health insurance. A lot of it has been, this is below me. Health insurance is for an insurance agent. I'm not doing that. I'm more about financial. I'm a
financial advisor, big picture investment, stocks, that type of thing. Yeah.
But the certified financial planner in me says, let's look at the big picture. And health insurance is if not the biggest expense for people.
Well, yeah, they say in retirement, and I just read this again, the studies say $280,000 plus is what the average couple will spend in retirement on healthcare.
Yeah, it's no joke. So financial advisors that are saying health insurance is an afterthought or for someone else to deal with, they're doing you a disservice. At the same time, health insurance agents are not necessarily prepared for this type of conversation. They'll look at the plans and the benefits and they'll understand the costs. But when you start getting into modified adjusted gross income, healthcare subsidy calculations, how to manage and manipulate your taxes to generate the highest subsidy, health insurance agents are overwhelmed as well, because they're starting to feel, wait a sec, this is not in my purview. So you have to work with somebody that is willing to talk to the other side. So you have to find a financial advisor that will work with a health insurance agent and have a conversation, an intelligent one. Or in my case, you have to have someone that's duly licensed, that has the experience, that is willing to have these conversations, because it's ever changing. And you really have to be strategic about it. And I find some of the conversations I have with my clients, we talk about getting an extra bit of return in the stock market, or reducing expenses or income and so forth, and figuring out guaranteed income, or going for the long shot in the market, and getting that extra little bit of income, getting that extra little bit of return. And then when I bring in the conversation, do you realize I'm going to help you get an $18,000 a year subsidy? Is that going to change anything?
It's huge.
All of a sudden it's like, why didn't you lead with that? Come on, buddy. Who cares if you give me an extra 0.5% of interest on my CD?
Right.
This is big bucks here. And so I think it's a huge, huge thing. I don't know if people realize how much this American Recovery, or what is it, American Rescue Plan, has impacted health insurance. It's going to come to light, and I'm there and front and center. I'm going to be helping every one of my clients that have health insurance through the marketplace, or that were wanting to get into the marketplace, to just couldn't afford it, didn't know. Now that this has changed, and we're going to get enrolled, and I'm going to be sitting down. This is what I'm going to be doing. This is my summer.
Well, that's why you've earned the nickname Financial Panther, eh?
And like the Panther, Florida Panther, we're a rare breed. We're
Financial Panther, eh?
We're going extinct, honey.
This is a huge show. This is a huge show. You know what? It's so big, it deserves an orchestra hit. Right there. I mean, the impact, seriously. And that's why it's great that you're willing to look at it. And it's crazy that so many so-called financial services professionals out there are so focused on investments and taxes. Oh, I'm going to, we need to look at your taxes. And that's smart. There's a lot of money to be made up and saved by making smart tax decisions. You've had shows on that. But they don't. You're right. They don't. Can you save me $18,000 next year on healthcare? Well, that makes a huge difference.
And we're not even talking about different types of health insurance plans versus. We're not even getting into that. We're just talking raw money to buy something. It's like, here's money. Go buy something that works. So it's an amazing conversation. We talk about Social Security. How often do I talk about Social Security and how you can get an extra $50,000 over your lifetime? Here's an extra $10,000, $20,000 this year. Huge stuff.
For people in the right if your circumstances meet those criteria,
that's right.
The money is there, and so you want to utilize all of the benefits that are offered by this new American Rescue Plan, but you have to know about them first and know how to implement it and know where to go. Maybe look back and say, okay, is there something? Is there still time for me to take advantage of this? And I think working with somebody like yourself to sit down and look where you're at financially is so smart. So, Dan, how can our listeners get a hold of you to sit down and figure this out?
Yeah, and I got a couple of people that I work with at Dolphin Financial Group that are specializing in health insurance, so they can also help. So it's not just me.
Medicare, health insurance, to see where you're at.
Yeah, and doing these calculations, we integrate it. And by the way, Tony, you got to act quick on this, not because you're there's a deadline. Not only is the open enrollment period open just for an extended window here, but it's not retroactive like the last show. So you can't say, I want to get subsidy for the January, February, March. If you want to start this in April, you got to do it now, and it's going forward. So you got to act. So the easiest way is just go to dolphinfinancialgroup.com and connect online and set an appointment that way. And, on our Google page or on Facebook, however you want to do it, on our website, or you just give me a call, 888-508-5935, and get in touch with us. We will gladly help people through it. And if we don't answer, leave a message, because we're going to be dealing with all of our existing clients, getting them the additional subsidy amount. I have a feeling it's going to be really a pleasant pleasant surprise for quite a few people. Even those that are against the current administration's policies, they're going to say, all right, I don't like this policy, but hey, more money in my pocket, I might as well take it.
Well, yeah, we're not even talking about the political aspect of it, really, or politics aside. These are rule changes that you should know about and take advantage of while they exist.
Yeah, absolutely. So that does it, Tony. Thanks for another good show.
Awesome,
and thanks for sharing my enthusiasm about how important this really is. I think it's going to be, like I said, financially life-changing for quite a few people out there. And I'm happy about it, and I'm happy to share the message. Hopefully people will take advantage of it. So thanks, and have a good day.
All matters discussed in today's show are for informational purposes only.
This show is not investment advice.
Dan Wendell nor Dolphin Financial Group are affiliated or endorsed by any government agency.
Investment advisory services are offered through Dolphin Wealth Management, Inc., a registered investment advisor in the state of Florida.
Insurance products and services are offered through Dolphin Insurance, Inc.
Dolphin Wealth Management, Inc. and Dolphin Insurance, Inc. are affiliated companies doing businesses as Dolphin Financial Group.
You should talk to someone at Dolphin Financial Group before implementing any of these strategies or ideas.